Victoria has recorded another 13 COVID-19 deaths, and hospitalisations have risen slightly across the state. The number of people in hospital after contracting the virus now sits at 553, up from the 543 reported on Thursday. Of those patients, 82 are in intensive care units, with 23 people on ventilators. The state reported 8,521 new infections, 3,162 from PCR results, and 5,359 from rapid antigen tests. It takes the number of officially reported active infections to 55,617, down from 55,946 yesterday. About 49% of the state's adult population has now had a third dose of a COVID-19 vaccine. It follows news that Australians will now need to have received a booster dose of a COVID-19 vaccine to be considered up to date with their vaccinations, based on new advice from the Australian Technical Advisory Group on Immunisation, ATAGI. Those not eligible for a booster will be considered up to date after their primary vaccine course. ATAGI's new advice was endorsed by the National Cabinet at a meeting on Thursday, but will not apply to international travellers arriving in Australia. Under the new rules, if it has been longer than 6 months since someone's last vaccine dose and they are eligible for a booster, they will now be considered overdue. It was announced yesterday the deadline for key healthcare workers in Victoria to have a third dose of the COVID-19 vaccine was extended by a month, pushing the new deadline to March 12th. Victorian Meta hotels to be decommissioned. The government will shut down 2 Melbourne Meta hotels converted last month to cope with surging case numbers and dwindling staff availability. More than 300 COVID patients were transferred in January to the Pullman in the CBD and the Mantra in Epping to ease pressure on the hospital system. The government said reduced case numbers meant the facilities were no longer needed. The fact the Omicron wave has subsided and that they were not needed as much as anticipated is a good thing for the health system and the Victorian community, a Victorian government spokesperson said. Patients able to recover at home will continue to be supported through the expanded Hospital in the Home program, keeping hospital beds free for those who need them most. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. Watch duration, 2 minutes 3 seconds 2 minutes and 3 seconds. Data shows many older Australians haven't had their booster.